Is that you, Carla? I haven't seen you in years. How have you been? Yeah, I've been good. I'm just on my work break. I like to walk in this park when I get too stressed in my work environment. What do you mean by that? Is everything okay? I've just been feeling very stressful lately. So stressed it makes me feel sick. I think something's wrong with me. It sounds like you have an anxiety disorder. I see this all the time in the hospital I work at. Please tell me more. I'm getting desperate. Well, anxiety is characterized by persistent and chronic worrying about current or future events. Symptoms include an increased heart rate, shallow and rapid breathing, difficulty concentrating, and a general sense of uneasiness. On top of this, it mostly affects women, people with other diseases, as well as Aboriginal and Torres Strait Islander population. Risk factors include substance abuse, excessive stress, genetics, and past trauma. Well, my job is very fast-paced, so there is a lot of stress, and my mother exhibits the symptoms you're proposing. Maybe I've got it from her. Come on, let me take you to the hospital I work at so I can give you a better understanding of how anxiety works. Scientific equipment such as functional magnetic resonance imaging, fMRI, and positron emission tomography, PET, allow us to trace and pinpoint the areas of the brain responsible for the learning and unlearning of fear. Brain scans reveal that fear predominantly stimulates the amygdala, as well as the prefrontal and sensory cortex, thalamus, and hippocampus. You can picture the amygdala as the overseer and coordinator of fear. A stimulus is brought to the amygdala by the sensory thalamus, prefrontal, or sensory cortex, and it is regarded as a threat. Your amygdala then sends this information to your brainstem and hypothalamus, causing a chain reaction of hormone release, eventually flooding you with stress hormones known as cortisol or adrenaline, the fight or flight response. Oh wow, you're right. Every time I get hit with a wave of panic, I flee to that park for relaxation. Should I take medication to fix this? I would suggest taking cognitive behavioral therapy to start off. This involves re-educating the mind to help unlearn these fear responses through breathing exercises, progressive muscle relaxation, and exposure to triggers that make you anxious. If medication is needed, selective serotonin reuptake inhibitors, SSRIs, or selective serotonin norepinephrine reuptake inhibitors, SNRIs, might be the way to go. SSRIs assist in balancing your serotonin levels, which can reduce anxiety symptoms. SNRIs do the same, however they influence norepinephrine, a neurotransmitter responsible for important functions such as heart rate and breathing. Now it's crucial I talk to you about two current technologies that have tremendous potential in the future. Firstly, transmagnetic stimulation, TMS, is a non-invasive process of stimulating the brain with pulses to understand the brain-behavior relationship of mental disorders. These pulses cause action potentials, which is the firing of a neuron, to study how well your brain is sending and receiving messages or to excite or inhibit neuron communication. TMS has exhibited some promising success. Low-frequency doses to the left and right motor cortex has been shown to reduce states of hyperarousal and temporarily improve symptoms of anxiety. Furthermore, a combination of low and high-frequency pulses to the prefrontal cortex promotes a balance in brain activity and thus should be considered as a therapeutic option. Despite this, the current literature states far more experimental research is needed, as there are no internationally recognized guidelines of treating different conditions. The future of TMS will be able to target parts of the brain reliably and accurately with specialized frequencies and intensities to best suit the individual. Failure to specialized treatment can be dangerous and can intensify the original symptoms. Ideally, we will have brain scans calculating exact pulse frequency and strength to ensure safe and permanent release from anxiety. Now let's talk about another technology. Neurofeedback is the training of the brain to improve efficiency of functioning. This process predominantly uses an electroencephalogram to reveal to the subject their own electrical brain activity so as to guide them towards desired mental states. This self-regulation is commonly taught in the form of a video game where the goals of the game shape more desirable and regulated performance. Learning to self-regulate can help you understand anxious states and how to use tactics to overcome these states. fMRI, which I mentioned earlier, has also been successfully utilized as a neurofeedback tool. fMRI feedback allows participants to re-evaluate a certain trigger of their anxiety and decrease their stress response through a method called cognitive appraisal. This refers to re-evaluating your thoughts of fear and realizing that it is irrational. The future of neurofeedback can benefit tremendously from the implementation of virtual reality technology. Fully immersive video games, which train your brain to deal with and minimize stress, can be an effective method in years to come. Now, let's go for a quick walk so I can give you my final thoughts. To sum it all up, neurofeedback is certainly the safer and more reliable treatment option. TMS requires further research, however it exhibits tremendous potential in the coming decades. Wow, so the future of anxiety looks very bright. You've shed some important light on the issue. Thanks so much. See you later.